Does it work? Okay, welcome everyone to the BSN session. We're excited to see you and hope to see you next year. I just want to introduce myself. I'm Helen Baker. I'm an associate professor and I'm the BSN first year program director, along with Shannon Stevenson, who's the second year program director. And we're going to do this, we're going to talk about a really interesting opportunity in the BSN program first, and then we'll do an overview of the BSN and I'll answer any questions. So I just want to introduce Casey Arone, who is going to talk about this HRSA-funded program called In Motion, which is the Emory Nursing Mobile Opportunities for Training and Innovating Nursing.
Thank you so much, Dr. Baker. Welcome, everyone. So as she mentioned, I'm going to talk a bit today about an opportunity that's open to you all. I'm going to probably go through this pretty quickly in the interest of time. I did leave some flyers here, so feel free to grab one of those, and I'll also hang back after the session if you have any other questions. I'm happy to either share my contact information or just tackle those questions with you if you do have time. So Emory in Motion, it's a HRSA-funded grant that was awarded to the School of Nursing in 2022. The goal of the program is to grant access to primary care for medically underserved communities. There are two primary target areas. One of them is Metro Atlanta. So we have some clinical partners in this area that we work really closely with, and then also a rural area, which is the Farm Worker Mobile Health Program. You'll probably hear a good bit about that throughout the day. So the way that we do this is through nurse-led mobile health teams in both of those target areas. And one of the other goals is to strengthen training to diverse nursing students in both the pre-licensure students for you all. We also have some post-licensure students in the program. And we offer a lot of training in social determinants of health and culturally and linguistically sensitive care integration while you're working in those environments. So the program was awarded to Dr. Quinn Fan, who serves as the project director, so you'll see her quite a bit if you do apply. We also work with Dr. Erin Ferranti, who's the co-project director, but also the director of the Farm Worker Mobile Health Program. You'll hear a good bit about the summer immersion in Moultrie, Georgia, so she heads that up. We also work with liaisons from both pre-licensure and post-licensure programs. So Dr. Baker, who you just met, is our liaison for the BSN students. And so they work closely with us to ensure that the curriculum aligns with what you all are doing in your programs. We also have other faculty that we work with to ensure integration of social determinants of health curriculum. Dr. Muirhead, who's in the room today, heads up our diversity, equity, and inclusion initiatives. We also work closely with the Program for Evaluation and Quality Improvement at the School of Rollins, just to ensure that we are implementing best practices and giving the best possible experience. The lovely folks at the bottom here are some of our clinical instructors that we work with and our liaisons at our community partners. So for those of you that decide to participate, you'll be working pretty closely with those folks. Some of our community partners include Boat People SOS. They work with a lot of refugee populations, Georgia Harm Reduction. They handle a lot of substance abuse and vulnerable communities. The Ventanilla at the Mexican Consulate, we also work with them quite a good bit, and those three are all here in the Metro Atlanta area. And you'll see them probably throughout some of the clinical requirements for your program, but they do have some outreach initiatives, and so we tap into those to give you that hands-on experience in mobile environments. The Colquitt County Board of Health, that is the farm worker program that we also work very closely with. Our BSN students typically don't work with them quite a bit because it is, when I say South Georgia, it's far South Georgia. So we do have an opportunity in the summer for you all to work with them, but that's primarily in the spring and fall is primarily our post-licensure students, but there is an opportunity for our BSN students to participate in that summer immersion, which is 2 weeks in South Georgia. So for a little bit of background, the reason for the grant, and some of you may be familiar with some of these already, but the lack of continuity in care, poor access to care, whether that's because of geographic location being rural or having some unhoused or low-income populations, the high cost of healthcare, I think we've all heard quite a bit about that, And then focus on acute training for nursing training, and then a lack of alignment with the nursing workforce with the populations that they serve. So Emory in Motion aims to counteract those issues by closing the gap, offering healthcare where people are, and that's the mobile initiative. We're going to these communities that are underserved so that we can provide those primary care services that are lacking. Our target audience, of course, the pre and post licensure students here at Emory, and we're aiming to recruit 70% of a diverse background in our nursing trainees. We do offer financial support for our students that are accepted to Emory in Motion. We do that two ways. There's a $2,000 per semester scholarship that's awarded to our students, and we also have a stipend that is awarded in the event that you do participate in the summer immersion. The summer immersion for Emory in Motion is optional for our BSN students. We do make it mandatory for our post-licensure students, but as BSN students, you can opt in or opt out to participate in that. I will say I highly encourage it. The feedback we've gotten from our students so far is that that was one of the most rewarding experiences. So if you do participate, I definitely encourage that. The program overall does require 80 clinical hours. These hours are already aligned with the requirements for your program, so don't let that number scare you. It's actually pretty attainable, particularly if you do participate in the summer immersion program. So this is a bit what the curriculum looks like. Again, there's a minimum 80-hour requirement, but you can see how over the course of 2 years plus 1 summer, you can attain much more than that. So it starts off in the fall, which is the first year of the program, with some service learning hours. The public health practicum does require 60 hours, so you can see how you can get a vast majority of your hours there. And then that 60 hours in the middle, that's the summer immersion program, which again is optional for our BSN students. Again, I do want to point out that the course requirements and clinical hours are already designed to align with the BSN program for you all. And so, for example, with that public health practicum, you're still with your cohort of students that you're here with today. The difference is that you'll be focusing on those clinical partners that I share with you and those mobile health sites, whereas some of them may be at some of the other clinical sites. So we're still in alignment with your program. Your clinical days will be the same, just the location will be different because your focus will be on that mobile health initiative. Skip over the MSN since that doesn't apply. And so some things to accept: you'll submit your application if you're interested. We will notify students that are accepted in March, and then there will be an agreement that you'll review and sign and send back to us, and then we host our kickoff in August. Clinicals, again, are typically aligned with the clinical schedule for your program. I just want to make sure that we set that expectation. There may be a handful of additional opportunities that may include weekends. And so an example of that, the Mexican consulate, they do have a couple weekends in the year where they go out to some rural sites. And while they do they typically do passports and things like that for people who can't reach the consulate. So the Ventanilla sets up a pop-up clinic, essentially, and so our nursing students have an opportunity to participate in that. And there may be a handful of those that you can participate in. Throughout the program, you can expect some additional training opportunities, such as simulations, some online modules. We understand the commitment of the nursing program, and so there are not too many of those, but these are some training opportunities that we know are valuable. In preparing you for things like the summer immersion, we found that some of these additional training opportunities really do make a difference, and so you'll get that extra training as part of program participants. We do have monthly meetings with the project director, and again, we work to align those with the days that the students are already on campus, so it's not meant to be a burden, but certainly an essential part of the program. And then as Emory in Motion scholars, you're just expected to actively participate in these training opportunities, keep up with the schedule, and then communicate with our Emory in Motion team. So a little bit about the summer immersion program. This is 2 weeks in South Georgia. I also want to point out that we use some of these terms interchangeably. So when you see farm worker program or Moultrie or the Ellington Clinic, those are all the same thing. And so for our BSN students, again, this is optional, but certainly highly encouraged. And one of the great parts of our grant was we were able to provide the Ellington Clinic with the mobile van that you see in the photo here. So we're excited for our students to go down and have the opportunity to work on that van and work with the farm worker population there. So how do you apply? I've included a short link here as well as the QR code. Feel free to also grab a flyer. The application requirements include a resume, a personal statement. There is an application online that you'll be required to fill out, and those applications are accepted through February 29th. And then we also ask for one reference letter. A couple quick tips from the person that has to screen the applications. Be sure that you read and follow the instructions very carefully. Ensure that your resume is current and tailored to the program. For your personal statement, make it relevant to the program objective. So again, just read those instructions carefully. And then your reference, make sure that it's a strong reference and also follow up with them to ensure they submit it on time for you. And then also be sure that you submit all your applications online. You don't want to be essentially disqualified when you're a good applicant just because your paperwork wasn't in. A couple quick questions about transportation to clinicals. You are responsible for arranging your transportation. However, the program does offer support. So whether you all want a carpool and then one person gets mileage reimbursement, we do try to make it so that those things aren't a burden on the students. How is your financial aid dispersed? This will be awarded through the financial aid office. It's essentially going to be in your financial aid package. I do want to point out that if your tuition is already fully funded, you should not expect the Emory in Motion scholarship to be, I guess, like reimbursed to you, like how you would typically get a refund. It has to be in your financial aid package. Stipends will be paid directly to you, and again, stipends are for those that participate in the summer immersion. You do have to be full-time to participate in Emory in Motion. All right, so that brings me to the end. Looks like we already have one question. Go ahead. I've responded to everyone, but give me your name. I can actually double check it for you before we go. Okay. Any other questions? Great. Yep. Go ahead. You don't. I am not sure about the other. I know they do accept some BSN students. Dr. Baker probably would be the best person to answer how that works for the students outside of Emory in Motion. Yes. So the summer immersion is arranged through the Lillian Carter Center. They arrange housing, but Emory in Motion covers your housing costs. Mm-hmm. Other questions? All right, I'm going to turn it back over to Dr. Baker, but again, I will be around, so feel free to stop me and ask any other questions that you think of. Thank you so much for your time.
Welcome, everyone. Yes, to answer your question, BSNs who are not in Motion are able to go to talk to us about it. It's not like a widely available immersion but it is possible. And there's also opportunities to be like the student sort of research assistant. Well, welcome BSNs, potential BSN students. My name is Helen Baker, like I said. My office is in the Lillian Carter Center, which is just one floor up from here. Here's my contact info. So we're the only first degree program within the School of Nursing, so we're quite unique. And the wonderful thing about the BSN program is I think you have the most external opportunities within the School of Nursing because you do have that summer off. So every single day I get emails about opportunities for my BSNs to do in the summer for externships or internships, and they're mostly paid. So this is a really wonderful program to be in. We're ranked number 3 nationally for undergraduate nursing programs. And we're a 4-semester program with the summer off. We have lots of faculty and lots of part-time faculty. We have 60 fellows in the American Academy of Nursing, which is an honor within nursing. We have lots of scholars and researchers and many, many guest lecturers and visiting scholars, including people from the CDC, which you can actually. So this is hot off the press. We are starting a new curriculum. Yeah, this is not available on any website, but it has been approved by the faculty. So this is what the plan of study will likely look like. I guess it's potential it could change a little bit, but this is likely what it's going to look like. So the first semester you'll take pathophysiology, health assessment, fundamentals of nursing practicum, which will most likely be in a nursing home. Fundamentals of nursing practice and fundamentals of nursing practice clinical, professionalism and professional identity in nursing, and then determinants of health and health promotion. And with that, so you'll have 68 hours of clinical in a nursing home, you'll have 15 hours of simulation, which will be in the lab, and then you'll have 30 hours of service learning, and we'll be working with our community partners. So you'll be out in the community a lot this first semester, which is great, and not always the case in all nursing programs. Second semester, you'll be taking pharmacology. We switched it, so in some programs we had pharmacology and pathophysiology in the same semester, and that's a lot. So we did split it out this time. So you have pharmacology and then ambulatory care and community health nursing. Which is pretty unique to Emory. It's an opportunity to learn about working in ambulatory care. I think that is the future of nursing, is working a lot outside of the hospital setting. And it's pretty unusual to get a clinical experience in ambulatory care and community nursing. And a lot of the internships and externships that I'm getting, the new ones that I'm getting, are in these ambulatory care settings and care coordination. So don't think you have to do your 2 years of med-surg to be a nurse. There's so many opportunities for you. And then you take behavioral and mental health nursing and healthcare quality safety and informatics. One of our big pushes within the School of Nursing is kind of to be at the forefront of nursing informatics. So if you're interested in informatics and using technology within nursing, this is a great school for you. So then the summer, you get the summer off, which nobody else does. So you can do whatever you want during the summer break. You can do externships or internships. You can work. There's a number of study abroad programs within Big Emory. And then there's the immersion program. So the picture here this is in the farm worker program, which you can do. And this is in one of the study abroad trips. Or you can just relax and refresh yourself for year 2, which is also a valid and good option. Does anyone have any questions about the summer and how that works? So semester 3, you would take reproductive health and gender-related care, which is kind of traditionally what we call maternity, but we're expanding it to make sure it includes more than just labor and delivery. Maternity, reproductive health care is expansive. And then we have pediatric and young adult nursing. And then we have adult and older adult health nursing, and then nursing scholarship and evidence-based practice. So you have a ton of clinical your 3rd semester. So you do your reproductive health clinical, which will be in the hospital and hopefully also in outpatient and community health. And then pediatrics, again, will be in the hospital. We have a new opportunity within our pediatrics clinical to go to Minnesota Children's Hospital, which would be fully paid. So if you're interested in Minnesota, that is an opportunity for you. Minnesota Children's Hospital. It's in Minneapolis. And then adult health is mostly working in the hospital. And then nursing scholarship and evidence-based practice, you'll be learning how to use research into your practice. Then fourth semester, you take public and population health nursing, and then the associated clinical. You'll take care of the care of the person with complex health conditions. We spent a long time figuring out what this was going to be called. Apparently, we chose a really long name. That's basically ICU and step-down units, transition care, and we have added in a clinical component to this class. We have this class currently in our curriculum. It doesn't have a clinical. So this is an opportunity for you to get a clinical, everyone to get a clinical experience in ICUs and kind of higher intensity care units. So that would be like transplant units and ICUs and infusion centers, that kind of thing. So if you're really interested in this more high acuity, you don't have to be like, I'm not going to get it for my final role transition. We're going to give it to you in group settings because we have both, well, there's need for nurses in every area, but we want to give you experience from working in this community setting to working in these really high acuity settings. And then pathway to practice is that sort of one-on-one preceptorship where you pick an area of nursing that you're interested in. And hopefully we are able to get the area that you're interested in. If you're interested in a specialty area, it's a little harder. If you want to be a med-surg nurse, the world is your oyster. You can go to any hospital you want to. And then we have this thing called master class. So we don't have any electives that are required within the curriculum. Our old curriculum did have required electives, but we don't have that anymore. So you can choose one of these 5 courses, which is health systems leadership, global health nursing, data science and decision making, policy and civic professionalism, and ethics and history in healthcare. And so you'd pick one of those classes to take as your as your master class. And then, so that's a total of 60 credits and 555 clinical hours, 142.5 simulation hours, and 30 service learning hours. So you get a ton of We'll still be offering electives, they just will no longer be required. These are just some of the electives that we have. We don't offer them every year or every semester, but really popular ones are the Intro to Critical Care, Fundamentals of Wound Care, Birth and Global Health, ECG interpretation. So we have some good electives, as well as the primary care elective. Apparently I forgot to put on this slide. The primary care elective is required for the in-motion students. So who are our clinical partners? Basically, all the clinical area of Atlanta are clinical partners, as well as ones in the region and in the globe. So Emory Healthcare has 11 hospitals, Children's Healthcare of Atlanta, the Veterans Affairs Medical Center, Brady, Piedmont Healthcare, Northside Hospitals, Wellstar Health System, and then many, many, many community partners, health departments within the metro area, many of the ambulatory care clinics as well. Then global opportunities, this also makes Emory pretty unique. We have an endowment to be able to help support these global opportunities. And we consider global health as sort of everywhere in the globe. So it's not just an international trip, it's within Atlanta, it's within Georgia, it's within the US, and it's also international. So you will have an opportunity to do a service learning immersion during spring break. And it is still spring break, I was just making sure, because now it's 4th semester, we used to have it 2nd semester. So it would be your 4th semester of your program when you would do an immersion. And so what you would do is usually public health is blocked, and so you do public health that first block of the semester and then go on the immersion, which would count towards your 20 hours. There's also opportunities within the Emory Global Health Institute, which is also just down the street. Emory develops some of the big HIV drugs, and with the money they earned from selling the HIV drugs, they didn't sell them, but from developing them, they created this Global Health Institute. And there are a number of opportunities to work with other schools within Emory, as well as other partner organizations globally. So one thing that you can do in the summer is sort of group project working in a global setting, and that could be in Atlanta, it could be in another country, could be in another state, and it also could be virtually. So there's lots of opportunities there for summer activities, and they also have some other programs, like there's a case competition that you can win prize cash money, working with others, students from other schools as well. I'm going to show this little video. So we had our 20th anniversary for the Lillian Carter Center. If you're interested in more about the Lillian Carter Center, we do have this very extensive ebook that we put together for the 20th anniversary, so you can kind of see the history of Lillian Carter and of our center as well. These are from our partners in the Lillian Carter
Hello from the Bahamas to all of our friends and family at Emory University. I'm Yolanda Pawar, the Chief Communications Officer here at the Wanda Luther Foundation and the Center for Training and Innovation in Rock Sound Eleuthera.
Hi, I'm Kristen Hamner, the National Director for Foundation for Peace in the Dominican Republic.
Hi, I am Dr. Cici, Directora Médico, Fundación para la Paz.
Hello everyone, I am Valentin, the National Director of Foundation for Peace in Haiti.
Hello from Actors Express, and thank you for all of your help during the COVID shutdown.
Hello everyone, my name is Catherine Lovern, and I am the Executive Director of Living Proof Recovery in Rome, Georgia.
It is my esteemed pleasure to celebrate the 20th anniversary of the Lillian Carter Center with you, and to reflect on the incredible impact of our Service Learning Partnership.
We have had the giant honor and pleasure of having a partnership with the Lillian Carter Center and the Emory nursing students.
Without your teams of students and your great researchers, we could never have opened as safely or as quickly as we did.
I had the privilege to serve the Emory nursing students, and they are like a great team of friendly people, hardworking.
And we wanted to take this minute to thank Emory University and the Lillian Carter Center for all of the fabulous work that your teams have done with us here in the Dominican Republic, treating people in some of the most difficult conditions.
Emory University and OEF have worked together since 2005 to support nursing student cross-training programs and research on Eleuthera.
We enjoy having them here and going through the process of learning and growing and experiencing things, and also getting to know each other's perspectives, whether that be clinical or peer-based services.
Health and wellness are key focus areas for us, and Emory University has been a true partner in helping us to assess and support the health-related needs of our community.
The pandemic really hurt us all a lot, and it's great to know that collaborators like you are in the community to make sure we can all get through it a little smoother.
In the process, we have forged so many meaningful friendships and a deeper cultural appreciation that has brought joy, curiosity, and purpose to our work, while connecting our lives and careers beyond geographical distance.
They have been absolutely wonderful, and we enjoy it every single time that they come. We always have a really great time.
The long-standing relationship between our organizations has created a collaborative working partnership and a valuable exchange of information and best practices for both Emory students and our local nurses and healthcare practitioners.
And it's great conversation, and they're always respectful and always willing to learn, and we get super excited when we get the opportunity to have them back here in Rome.
On behalf of our President and CEO, Mr. Sean Ingram, and our entire team, congratulations to you on this great milestone.
I just want to say thank you to all of you. We really appreciate you here at Living Proof Recovery, and I hope you have a wonderful holiday season.
It's always a blessing for Haiti when Emory comes.
For this, we say a heartfelt thank you.
Congratulations.
And thank you so much.
Thanks for all the work you do.
Thank you.
So one thing that we, oh God, backwards again. One thing we do take very seriously within our immersion program is that we follow all the rules and regulations within the country we go to, and that we are invited to go to that country or the place or the organization. So for instance, I take students to the Bahamas. I have a Bahamian nursing license, and we are registered within the Ministry of Health, and we only do things that within the protocols of the nurses. So this isn't some rogue trip where we're like, we can do whatever we want to. We really think of it as an opportunity for us to learn from the nurses working in those areas, and not necessarily us that being that helpful. We are a little bit helpful, but mostly it's us to learn from them and see, all the rich resources that they have and the way that they deal with similar health problems that we do. We do have very active student life at Emory, especially within the BSN program. So there's opportunities within student government, the Emory Nursing Student Association, the Emory Global Health Nursing Association, Speak Out Emory, the National Black Nurses Association. There's student ambassadors. I think we have a student ambassador up there. They're wearing the polo shirts, the blue polos. So if you're interested in student ambassador, we have some here. Honor Council and school committees, and then Sigma Theta Tau International, which is the Honor Society of Nursing. So the top third of every cohort gets invited to join Sigma Theta Tau International their third semester. We do have a lot of advising and academic support. One of the new initiatives we have is called the NEST initiative. So if you feel like you need additional support than what you're just getting in the classroom, we do have opportunities for one-on-one tutoring as well as group tutoring, study skills management, using how to use technology. So we have a lot, and also some sort of self-care workshops and groups. So lots of initiatives coming out of NEST. Some other special opportunities for BSN. So we have a partnership with the Veterans Affairs Nursing Academic Partnership, which is at the VA. And the VA hospital is just down the street from here. And you also have the opportunity, so you would do your clinicals at the VA, including public health clinical and ambulatory care clinical. You wouldn't do maternity, your reproductive health clinical there because they don't have that. But you do all your other clinicals there. And then there is a scholarship associated with that. And then there's an honors research program. So if you're really interested in research, that's an opportunity that you apply for. And then the Emory in Motion you heard about. So this is more information about VANAP. Barbara Kaplan is the coordinator for the undergraduate VANAP program. And then this is about the BSN Honors Research Program. So it's through the 2 years that you're in the program. Each semester you take one of the research honors courses that are electives. And we are hoping for it to be kind of a pathway into PhD programs, maybe at Emory, maybe at other places. So if you're really interested in nursing research, it's an opportunity to get to know the research area. You do have to have a 3.5 cumulative GPA to be admitted. And you have to be in the BSN program. The website is mostly up to date, I would say. Sometimes it's not quite up to date, especially with the new curriculum that will be updated once it's all approved. But we do have the faculty directory, the student guide, and BSN program information. So any questions? Yes. Question. I would talk email. Oh, yes, Katie knows. Oh, yeah.
I usually have clinicals like once a week. When there are multiple clinicals, are they still once a week and just separated throughout the semester, or how does that work?
So probably what will happen right now, how we do it, and I don't know if this is how we're going to do it with the new curriculum, we have them blocked, and so the first or second half of the semester, you do have 2 days of clinical, and then the other half, you'll have 1 day of clinical. So for instance, that third semester where you have 3 clinical courses, you would have like med-surg and maternity, and then peds.
When you were talking about the pediatric clinical opportunity in Minnesota, how would that work, like with attending classes? Like, would you just fly? Would it be like flying for the weekend, do your clinical, and then come back, or how?
Yes, so that would be your third semester. So probably it would be over fall break, and you'd miss a couple days of class. But what we're doing, this is the very first year we've done it, so we'll see. But right now we're doing it over spring break, and so you would do 5 days of clinical in 7 days in Minnesota. It'll be pretty tiring, but doable. In the Bahamas and Virgin Islands, you mean? Yeah. Yeah, I mean, it will depend a bit on what partners we're working with at the time, but yes, that we potentially could be going to St. Croix, St. Thomas, and St. John. It would probably be St. Croix or St. Thomas and St. John.
What part, or like if Haiti's still an option 'cause right now?
We aren't currently going to Haiti. It's a level 4 from the Department of State. And we don't travel to anywhere that is a level 4, unfortunately. So yeah, Haiti's on hold, but we went to Santo, which is a little outside of Port-au-Prince. And then we also had one that went to northern Haiti. Good question. No, right now we're on pause.
Motion, you get paid for the trip to Montreal. But if you're not in Emory and Motion, do you still get paid for the trip to Montreal?
You wouldn't get paid to go to Montreal. Yeah.
Stipend, that's essentially just us helping to cover travel costs and things like that. Not specific to Emory Motion. So.
Question with Emory in Motion. I was looking at the application and it asked about your proficiency in languages according to this specific website. And I clicked on it and it led to like an exam. Yes, I am. Yes.
That's just a reference. And so, for instance, when we go to Moultrie, we have a lot of Spanish-speaking folks. So that just helps us to determine like who we may place where and things like that. But it's not by any means meant to be like an official assessment. It's really just a gauge. So yeah.
With the study of broad opportunities, I was wondering how that works based on the nursing curriculum. I know like for prereqs, well, it can replace other classes. Would it be replacing any classes with the nursing curriculum?
Good question. So you could study abroad in the summer. Great opportunity. It would not replace any of your classes. We have a pretty tight curriculum, and for our accreditation, we have to make sure that we cover them in a certain way. So nursing is pretty inflexible when it comes to not taking classes. I think, a couple areas, like if you had a Masters of Public Health coming in, and we could probably waive the public health class, but not the clinical. So there's like a little bit of wiggle room for that, but not a lot. Yeah. Oh, okay. There. Okay. Yeah, so the summer study abroad program, we have Moultrie. And I guess to answer your question, how do you pronounce your name? There are work study positions in Moultrie, so I guess technically there is a very small opportunity to be paid to go to Moultrie. The study abroad would be with Big Emory, so you'd look at the study abroad office for the Big Emory. Yeah, yeah, good question. We had a question over here too, Casey.
Earlier, before when you were talking about like internships, externships, like additional opportunities during the summer, does Emory provide more information about that, or is that something we should be doing like on our own?
Yes, we provide a lot of information because lots of people want to hire our students. So we have a whole employment office that have 2 full-time staff in them. So Andrew Plush will come to talk to you about your resume and how to apply for these jobs and send out emails all the time about opportunities for the summer. You're welcome to do other opportunities that we don't advertise as well. There is, if you're interested in pediatrics, there is a summer internship at CHOA that includes a class, and so you get elective credit for that. It's called the Pediatric Elective. I forget what the P stands for, but it is also kind of a pathway into working at CHOA. So that is one that we would do a little more strongly, and you apply for that. It's pretty competitive for that externship. But yeah, anywhere is possible, and we do tell you a lot of opportunities. You're also, after you finish your first semester of nursing school, you're eligible to work as a nurse extern sort of throughout the semester as well, and as a CNA in many hospital systems. So that's also an opportunity. Does that answer your question? Yeah.
I have a question about the honors program.
Yeah.
So are the classes like electives, extra electives, or are they just like?
They're extra electives, yes.
Oh, okay.
Yeah, so. So you can take a maximum of 18 credits a semester. And after 12 credits, it doesn't cost you anything more. So if you like being really busy, then you're welcome to take more electives. And if you're a really strong student, then you're welcome to take more than the honors elective. But if you take more than 18 credits, like we have a couple people who are interested in going on to med school after nursing school, and then they have some other classes, prereqs that they need to take. And so you fill out a form that says, this is why I need to take more than 18 credits. And I have to review it, and then Dr. Swan has to review it. So it's not impossible. I just recommend that you be a really strong student to take that many electives. Yeah. Yes.
I was just going to ask, can you talk more about clinical placement with like transportation or carpooling, like we're living together, how much you can accommodate that? But then also, I have some older friends who classes are Monday, Wednesday.
Question. And this is one of the biggest problems within all nursing programs, I would say. So we expect that you're able to get to clinical, and that's just an expectation of the program. We do encourage carpooling. We don't organize it because of liability, but we do encourage carpooling. And if transportation is your biggest issue, if you're like, I can't transport very far, or I need to be at this we give you a sheet at the beginning of the year that says, these are my preferences for clinical, and I really need to be at these specific hospitals because I can't get there very easily. And so we will prioritize the location over your choice of type of floor, if that makes sense. So we do have some ability to help you with that, but we don't organize rides. We don't pay for rides. MARTA is not great, especially at 5:30 in the morning when you have to leave. We also do on that sheet that you fill out, you say like, for whatever reason, so clinical is any day that you're in class, you could have clinical, just because our class sizes are really big and we just need to fill all the potential spots. You should be lucky that right now we do not have overnight clinical except for in your final rotation. So I'm not promising that's never going to happen, but I know many nursing schools do have like a Friday night, like 7P to 7A clinical, and that's rough. So we don't currently have that. But it could be on Saturday and Sunday, so if you need to not do it on a Saturday or Sunday, in that form you'd fill out, you'd say like, I can't do Saturday or whatever days. Yeah. Does that answer your question? Yeah. If you do have like your car breaks down or something happens, we do have some emergency funds for like a week to cover you. We had a question over here as well, but yeah.
For scheduling, like
Very set. Right now, BSNs go to class in the spring on Mondays and Thursdays, and it's like all day long. Yeah. But I don't know what it's going to be with the new curriculum.
To add to that, when do we get our schedule so we can accommodate with work and stuff?
Good question. Usually you would have your class schedule pretty early on. You would have it like a couple months beforehand. The clinical schedule comes out, I would say, at least a month before the clinicals start. But always it's a little challenging because sometimes sites cancel or something happens. So we try to be about a month beforehand. Yeah. But you'd know your class, like what days you have class pretty early on.
Is it for the LVN NCLEX at any point?
What was your question? Sorry.
So since you guys make our schedule during like our class registration period, would we just not register for any classes?
Good question. So for the first semester, we register you, and then going forward, you register yourselves because you have an option often of which block you want to take different classes, and which like master class you want to take. So after the first semester, we register yourself, but we tell you when to register, and we don't give you a ton of options. But yeah, good question. Yeah. Oh, okay. Yes, got it. Probably about 5 weeks. You would do simulation, but your service learning hours would start right away. Yeah, but good question. Probably about 5 weeks, I'm guessing. And then second semester on, they would start right away. Questions? You buy uniforms, they're dark navy blue, and they have the seal on them. We do, I think, have a uniform library if you can't afford getting uniforms. I think we do have some uniforms available, but you buy them at the beginning of the semester or the year. There's also, we have all the information about what shoes, but yeah, closed-toe shoes that can't get. I think they have to be white or blue. I'm not remembering exactly what the written. Maybe Katie knows, or time's almost up. Yeah. I think all the instructions about uniforms are in the Canvas page, but I think we have opportunity to buy the uniforms through the bookstore. And then otherwise, I think we do allow people just to buy them and get the insignia. Become a little more flexible with uniforms. Not a ton more flexible, a little more. Thanks, everyone. This was great. Looking forward to seeing you next year.
No, if it stopped or if it's still going.
It's still going.
Okay, I'll. Oh, okay.